Thank you, Chris. And again, thank you to the members of the media for joining us today and for getting our message out. As always, we'll start with some numbers. As of this morning, Northern Light Health is caring for 41 individuals who are positive for COVID-19 reasons across our health system as inpatients. Eastern Maine Medical Center is caring for 24 individuals, Inland Hospital 3, Maine Coast Hospital 4, Mayo Hospital 4, Mercy Hospital 5, and Sebasticook Valley Hospital 1. In addition to that, our home care and hospice agency is taking care of 7 individuals for COVID-related conditions at their home. Our COVID positivity rate over the last 2 weeks is at 9.56%, and for the past week is at 10.15%. Just to remind you, that is the percent of positive tests over all the tests run by Northern Light Health Labs. And that is still a significant rate of positivity, and is a reminder to us that community spread continues out there, even though our hospitalization rates, thankfully, are lower at this time. We continue to share our COVID-19 hospitalization graphic with the public that details the number of people hospitalized with COVID-19 who are vaccinated and not vaccinated. The numbers continue to show that those who are vaccinated have lower cases of hospitalizations and severe illness. As we noted before, this graphic represents a snapshot in time, and the data is changing constantly. While many will find this tool to be a helpful tool, at Northern Light Health, we tend to look at trends over time. Looking at the long-term view is what makes us so confident that the vaccine's ability to reduce severe illness and death. We continue to work on ways in which we can share a greater level of detail while still respecting privacy, and we will reach out to you when we have more to share. The most important thing that we all can do to reduce the impact of COVID-19 is to get vaccinated. But as we promote vaccination, we are encouraged that progress is continuing toward developing antiviral treatments that could speed recovery. Prevention of serious disease through vaccination and treatment using medication could be a powerful 1-2 punch. Recently, Merck applied for emergency authorization for a new antiviral medication to treat mild to moderate cases of COVID-19. This potential treatment is in a pill form and can be taken from home. Other antiviral drugs could follow. While we don't expect an FDA decision for several weeks, we will monitor developments and deploy any new medications that may become available per FDA guidelines. We also continue to provide monoclonal antibody treatments when indicated. New antiviral medications will not bring the pandemic to an end on their own, but they will represent one more tool in our toolbox. That's encouraging, especially as cases continue to decline. As we discussed last week, the flu vaccine is now widely available and encouraged for virtually all adults. It's required for all healthcare workers. Those who qualify for a COVID-19 booster may be able to get the COVID-19 shot and flu shot at the same time. The Delta surge has and continues to be a significant burden to our healthcare workforce. A bad flu season and COVID-19 circulating together would just make things worse. So please look for clinics in your community or contact your primary care provider if you haven't already received your flu shot. It's an important step to protect yourself and others. And with that, I'll turn it over to Paul to talk about some employee issues.
Thanks, Dr. Jarvis. So I'm pleased to report as of the most recent update that we've had earlier this week, Northern Light Health employees are 95.5% vaccinated, and we continue to work to vaccinate additional employees toward the deadline of this Friday of this week, which is the last day on which to receive the Johnson & Johnson vaccine and still be fully compliant with the state's mandate to be fully vaccinated, meaning 14 days following your final dose of vaccine by the 29th of this month. So we are working hard to answer questions and addressing issues of any remaining hesitation or concerns that employees might have, and reaching out to them individually to ensure that all questions are provided with factual, up-to-date answers so that we can vaccinate as many as are able to get to be vaccinated. We also have made Johnson & Johnson vaccine available at each of our hospital locations and home care throughout the state to ensure that Johnson & Johnson is available to staff who are able to receive the vaccine.
Thank you, Paul.
Thank you.
And now, Chris, we'll back to you, and we'll open it up for questions.
Okay, thank you very much. Gentlemen, we're going to start off with WABI. Brittany, why don't you unmute yourself and ask your questions, please?
All right. Hi there. Thank you very much. Well,
Hi,
as
Brittany.
the camera is on Dr. Jarvis to start, I'll start with you. I have one question for each of you. First of all, I've heard, you just mentioned that vaccines are helping and that the number of people hospitalized remains predominantly unvaccinated patients. I've heard anecdotally that there are an increase in, vaccinated patients appearing in hospitals. Wondering if that is a trend that you are seeing, if it causes concern, and if so, do you believe that it's showing any signs of vaccines waning in their efficacy, perhaps necessitating the need for more boosters?
Yeah, so at this time, I don't think that is the case. I think for the overwhelming majority of individuals who are vaccinated with any of the 3 vaccines authorized for use in the United States against COVID-19, that their immunity is still very high and is still helping to prevent hospitalization and severe disease and death. And so I want to be clear about that. What we have seen, and I just looked at the numbers shortly before I came on here, is that those who are vaccinated who are in our hospitals generally are older and have some other comorbid condition. And in fact, it looks like those that are of a younger age almost exclusively are those who are unvaccinated. And so really it has to do with those particular individuals, that they most likely are somewhat immune compromised or are immune compromised due to their underlying illness or age, and therefore that's really where the trend we have seen. Now, obviously, nothing is universal, and there will always be some individuals who are healthy and fully vaccinated who still require services, but that is rare in comparison to what we see in people who are not vaccinated.
Thank you very much, Dr. Jarvis. My second question is there we go, across the room here. As we have seen other hospitals being affected by the vaccine mandates coming, the deadline coming up, would you be in favor at Northern Light of adding a testing component in order to keep that other 4.5% of employees still unvaccinated?
No, testing component is not as effective as a vaccinated staff. And so testing is appropriate for those who have a medical exemption and can't receive the vaccine. But to provide testing in lieu of vaccine for those who are able to receive the vaccine just isn't providing the level of safety that we at Northern Light believe is appropriate. We agree with the state's mandate and in terms of requiring healthcare workers to receive that vaccine. In addition, we know that there's activity going on at the federal level that would require that across the nation for healthcare workers, and we think that's the right move.
Thank you very much.
Thank you.
Thank you very much, Brittany. We're going to move on to Amy Brown from WERU. Amy, give me a second to unmute you.
I think I already unmuted myself, but
There you go. Great.
yeah, thanks, Chris. And thank you, both Dr. Jarvis and Mr. Boland, for talking with us today.
Thank you.
Following up on what Brittany was just asking, that 4.5% that are yet to be vaccinated, do you have a sense of how many of them will be, or do you think you're going to lose 4.5% of your staff coming up here at the end of the month?
I don't think we'll lose 4.5% of our staff. I think there's some number in that group who will opt to leave healthcare, and that's a decision that they need to make. I think that our focus right now is for the group within that 4.5% who still have questions, who have concerns. We want to get those responded to. We're hoping that number is very small who opt to leave healthcare, but at that number, we're certainly prepared to continue operations if they do opt to leave healthcare. But our focus is to keep them if we can, and we want to do that and respond to any questions that people still may have. And we're still hearing questions of which we're able to provide appropriate data and answers, and we're seeing people each day change their mind and make a decision to become vaccinated. So that's our focus right now.
And we've heard from early on when the vaccines became available that physicians were vaccinated in the upper 90% range. The 4.5% of the people who are still hesitant to be vaccinated, are they among medically trained staff or primarily among administrative or other custodial different departments within the hospital? Do you have a sense of that?
Sure, great question. Yeah, we do have that data. I don't have it at my fingertips now. I know that generally speaking, The higher level of licensure, meaning starting with physicians and working your way down in terms of degree attainment and licensure level, the most advanced trained clinical workers are the most highly vaccinated, and that continues to be the case, which means there's opportunity rather to provide education and information for some who still have questions. And so we know that our most educated clinical experts and scientists were some of the first to become vaccinated, and they continue to be advocates for other staff to become vaccinated as well.
Thank you very much for your questions, Amy. We're going to move now to Dana Rosengard from New Center, Maine.
Good afternoon, gentlemen. It's been quite a while since I've pulled this duty. I'm glad to be with you all, and it's a wonderful day when your colleagues ask the questions you had originally planned to. So I thank those two women before me, but I will follow up, if I may, with one question related to what we've seen at other medical facilities in the state. What concerns might you all have about being at capacity in any parts or units of Northern Light hospitals that could result in the inability to accept a certain type or class of patient going forward?
So Dana, first of all, welcome back, and thank you for your question. As we've talked about numerous times during these briefings, capacity concerns are not just related to COVID-19. We struggle with capacity concerns for many reasons in the state of Maine, not the least of which is we simply don't have enough healthcare facilities and beds across our state to manage all the various needs that we have. So this is just an added layer to that. So I will say that yes, we do have concerns about what will happen as the mandate comes into focus, and we have issues with shortages of nurses and providers and other healthcare professionals across our state. At Northern Light Health, we are prepared, as we always have been, to assist where we can and where needed, and we will do everything in our power to continue to take care of the communities that we serve in every way that we can. We speak frequently with our counterparts across the state so that we have up-to-the-minute information as to where each hospital is and what capacity we have, and we will continue to work with them in order to serve the needs of all Mainers.
Thank you.
Thank you, Dana.
Okay, next up, we're going to go to Joe Lawler from Portland Press Herald.
Hi, sorry, it took me a second to unmute. Yeah, just kind of piggybacking on what Central Maine Healthcare in Lewiston was saying yesterday. At 95.5% vaccinated and still, presumably more people will comply before the deadline. Does that mean that you will not be curtailing any of your services? You'll have your full range of services at Northern Light?
So I can start with that, and Dr. Jarvis can finish. We certainly are looking at our staff at every one of our hospitals, as we do on a daily basis, without regard to the pandemic. And so, on an ongoing basis, certainly we are looking at contingency plans on which employees are vaccinated, which are not, and what, if anything, does that do to our operational capacities. And we're certainly continuing to review that on an ongoing basis, but we don't expect any significant curtailments of our operations at this time, and we're open for business. And Dr. Jarvis may have some more detail.
Yes, thank you, Paul. And I'll just add that this is something that we do as a matter of course, day in and day out, is to look at what our capabilities are. And yes, indeed, there are times when we have had specific hospitals within our system who have had capacity issues that have required them to transfer individuals to another location. Sometimes that's because of capacity, but sometimes it's just because somebody needs to be transferred to a higher level of care. That's what happens as a routine aspect of things, and we will continue to prioritize that. At this time, we do not see that we will have significant shortages, that we will have to talk about a particular service or a service line that we have to stop, but we may come to the point, like we have in the past during this pandemic, of looking at individual cases and determining whether or not we can continue to provide a service at the moment. But right now, we do not anticipate that we will see a major issue with any particular service line or service that we provide. And we're very fortunate that we're able to say that.
Do you have a follow-up, Joe?
Yes, just one follow-up. is there a way to compare the lost staff time due to employees being sick from COVID-19 versus people choosing to leave healthcare because they're refusing to get vaccinated?
Sure. So if you're looking at a number of people comparison, I think when we look back at the pandemic and the height of prior to vaccination, we were at a peak of about 450 staff out at any given time because of quarantine or illness. And so our 4.5% is a little over 500 people who are not yet vaccinated. I believe strongly that number is going to drop to a smaller number who won't be compliant with the state mandate, and so I think it's relatively comparatively similar, I guess, in terms of the number of staff out. But again, we hope that doesn't come to pass. We hope that people change their mind and people have plenty of time to do that between now and Friday with our Johnson & Johnson dosage readily available.
Okay, thank you very much for that follow-up question. Joe, we're going to move on now to Blake Lipton from WVII, ABC 7.
Hey guys, thanks for taking my questions here. Was just wondering if you had any data or anything like that on how many people have left Northern Light because of the vaccine mandate.
So we've had 117 people leave our employment up to this point. Starting, and the vaccine mandate includes the flu shot because the first people who left were refusing to get the flu shot. And so when that mandate came to pass, so we've been tracking all of those departures, and so the number is 117.
Okay, and as we see other hospitals cut back services due to loss of staff and everything like that, my question is more for how are some of the smaller hospitals under your umbrella doing right now during the pandemic, and maybe how do you foresee them in the future responding to this? Are they having to turn away patients and go to other places, or how are they doing?
Dr. Jarvis, I think, provided some good commentary on that before, but really on a percentage basis, a similar percentage of staff unvaccinated exists in our large and small locations, and so the impact is still one where we don't see a significant or curtailment of services. Dr. Jarvis may have some additional information regarding our transfer center and some of the good work that goes on between small and large locations. Dr. Jarvis?
Yeah, as Paul said, right now it's remarkable actually what our smaller hospitals are capable of, and every day I am proud of the work that gets done at our small hospitals, including being able to take care of people who are severely ill with COVID-19. If you remember in the beginning part of the pandemic, it was pretty commonplace that any positive patient was transferred to one of our medical centers across the state, and that's just not the case anymore. They're able to manage them, and you heard the numbers today. Many of our smaller hospitals are continuing to care for those patients, and that's a credit to the staff and the workers and the providers at those locations that they continue to do that. Again, as far as any individual hospital right now not being able to meet the needs of their particular community, that has just not happened. Occasionally we do have the issue around bed space being available or staffing being available. And we adjust, and as Paul said, we have a transfer center that works 24/7 in response to not just Northern Light Health's facilities, but other facilities in regions that we cover, and assist them either in a transfer to a higher level of care or just assist them in managing their patients at their local level. And we will continue to do that as we always have. And I think, again, I'd like to just personally thank each and every person at our member hospitals and at our independent hospitals across the state who've just done a remarkable job. We do not see the horror stories that we have seen in other parts of the country. And a lot of that has to do with the healthcare workers and the dedication they have in our state. So thank you for the opportunity to be able to express that.
And thank you very much for those questions, Blake. We're going to move on to Bangor Daily News right now, and David Marino.
Hey, I think this question would be best for Paul, but Dr. Jarvis can feel free to chime in as well. Is the $146 million from the state that is going to healthcare facilities to address staffing issues going to reach Northern Light in time to address any worker displacements that the health system is facing? Why or not? Why not?
Yeah, I think I'll pass that one off to Paul.
Sure. So certainly, any displacement that we have, any worker shortage that we have, is one that we need to take very seriously. When we have, especially clinical staff, who are not available in numbers in the greater Maine workforce, then we need to bring in traveling staff, whether it's physicians, nurses, or other clinical specialties. And right now, with the national labor shortage, in particular for clinically trained employees throughout the country, the cost of those services is in many cases double or more what it was prior to the pandemic. And so certainly any dollars that the state would provide would be significant assistance in helping us secure those additional resources to help provide that care. So we would certainly welcome that. But we continue to work to source appropriate staff without regard to the state dollars at this time, because our focus really is meeting the needs of our patients today, and that's what we continue to do.
Do you have any expectation on when that money will reach Northern Light Health?
I don't have that information, no.
Okay, got it. And my next question is for Dr. Jarvis. You mentioned the decline in hospitalizations, and they have declined quite a bit at EMMC in recent weeks. You also mentioned that the positivity rate, seemingly from what you said, is not really going down at all. How could those two things be happening at the same time? Do you think we're turning a quarter in any way in terms of cases in Penobscot County, or is it just kind of not getting any better?
Yeah, so that is actually a difficult question to answer without more levels of information than is currently available to us. You know, typically we would talk about the positivity rate is a bellwether for what we'll see in the next week or two in terms of hospitalizations and severe disease. It's just the nature of coronavirus that everything always seems to lag a week or two behind whatever information we have. The good news is that we have seen a plateau of that positivity rate over the last few weeks. And in fact, national predictors look at Maine and feel that for the next 2 weeks we will remain plateaued. The last few briefings we have given, we have actually said that really the horizon didn't look as good, and that predictive models had us actually increasing in cases. So plateauing, while not where we want to be, is still better than where we could be. As far as hospitalizations go, I think some of it actually has to do with the fact that many of the people who were in our hospitals for long term have either recovered, which is wonderful news, or unfortunately died. And so we've seen that. And we've seen a little bit of an uptick in the number of deaths reported statewide across Maine. And so unfortunately that does play a little bit into the factor there. But I think also it's the fact that as many people who have been vaccinated in the state of Maine mean that they are not getting the severe disease that requires hospitalization. So even though there may be a disease out there and people are infected, their disease remains mild to moderate and therefore do not require hospitalization. We've also improved across the state our ability to administer monoclonal antibodies, which have been shown to decrease hospitalization and death in individuals who have mild to moderate disease who are at risk for developing severe disease. So putting all of those together, it is my judgment that that's really what we're seeing play out here in the state of Maine. I can't prove that at this point. Hopefully time will tell that yes, indeed, all the things that we put in place here in Maine have worked out to our benefit compared to, again, as we look at some other places around the country that were not so fortunate to have high vaccination rates or be able to have a statewide effort to treat individuals with monoclonal antibodies.
Thank you very much for those questions. And last but not least is going to be Ross from WNTW. Ross, you can unmute yourself and ask your questions.
Hi there, everyone, and thanks for taking the time to answer everyone's questions. I think it's safe to say that there are some healthcare providers in the state who are working to catch up to the spot that you guys are at with how much of your staff is vaccinated. With that said, though, there is a long way to go to get towards 100%, if that is the end goal. I know some other states, because of a lack of healthcare workers right now, have even started turning to options like having the National Guard step in and have some roles done. Is that something that you would see as a possibility here in Maine if healthcare providers continue to have a difficult time filling some of these vacant positions in the long term?
So I don't see the need for that within Northern Light with the high levels of vaccination that we've spoken about. I can't speak to what other healthcare facilities or employers might need to do, but I do know that the state The National Guard has been deployed in some instances early on in the pandemic, especially in our nursing homes and other facilities. And those facilities reached out, and the state responded with that support. So I would think if the need was there, that the same thing would happen again. I don't foresee that at Northern Light, but others may have that need.
And just a quick follow-up. It was mentioned earlier on in this briefing, and I know the governor has mentioned this as well. Incoming an updated federal policy regarding requirements for vaccinations, not just here in Maine, obviously, but it would be all across the country. Do you have any details on that you could share in a potential timeline?
I don't have details or a timeline. I'd be eager to hear what the federal government comes up with in addition to you. If it's something similar to what Maine has done, I think that would help us in Maine for the simple purpose of if you have healthcare workers who are considering coming to Maine or are in Maine, if all states have a similar requirement, then that doesn't put Maine at a disadvantage in terms of hiring, attracting, and retaining healthcare workers. So I do think at a national level, if that happens, that would be a nice equalizer that would make, especially in the southern part of the state, where employees can go to New Hampshire as well as Maine very easily. And if that comes to pass, I think that would again equalize and make Maine on par with other states across the country. So I see that as a positive, not certainly least of which would be the benefit to patients in terms of improved safety in the healthcare environment.
Okay, well, I think that's the end of our round robin questions from our media representatives. So I think we're ready to wrap up today's virtual media advisory. Thank you, members of the media, for attending, and thank you again, Dr. Jarvis and Paul, for making yourselves available.
Thank you.
Have a good.
Thank you, everybody.